Feeling low from time to time is a normal part of life, but sometimes low mood can become more serious and may require urgent attention. In this video, we'll explore which symptoms mean you should seek urgent care for low mood. We'll break down the warning signs, explain why they matter, and help you understand when it's time to reach out for immediate support. Let's start by understanding what low mood is and why it's important to pay attention to how you're feeling. Low mood, often described as feeling sad, down, or hopeless, can affect anyone. It might come and go or linger for days or weeks. While everyone experiences low mood occasionally, it's important to recognize when these feelings become more intense or persistent. Understanding the difference between a temporary dip in mood and something more serious is the first step in taking care of your mental health. Let's look at how low mood can present itself and why it's important to monitor your symptoms. Common symptoms of low mood include feeling sad, losing interest in activities you usually enjoy, changes in appetite or sleep, and difficulty concentrating. You might also feel tired, irritable, or withdrawn from friends and family. These symptoms can vary in intensity and duration. While they can be distressing, they don't always require urgent care. However, it's important to keep track of how often and how severely you experience these symptoms, as they can sometimes signal a more serious problem. Sometimes, low mood can escalate and become a medical emergency. Recognizing the signs that require urgent care is crucial for your safety and well-being. If your symptoms are severe, persistent, or accompanied by certain warning signs, it's time to seek help immediately. In the next scenes, we'll go over the specific symptoms that mean you should not wait to get support. Your mental health is just as important as your physical health, and knowing when to act can make all the difference. One of the most urgent symptoms to watch for is having thoughts of self-harm. This can include thinking about hurting yourself, making plans to do so, or actually taking steps towards self-injury. These thoughts are serious and should never be ignored. If you or someone you know is experiencing self-harm thoughts, it's important to seek urgent care right away. Reaching out to a healthcare professional, a crisis helpline, or going to the emergency room can provide immediate support and safety. Another critical symptom is having thoughts of suicide or making plans to end your life. This is a medical emergency. If you are thinking about suicide, have made a plan, or have attempted to harm yourself, you need urgent help. Don't try to manage these feelings alone. Contact emergency services, a crisis hotline, or go to the nearest emergency department. There are people who care and want to help you through this difficult time. Feeling completely hopeless or trapped, as if there is no way out, is another urgent warning sign. These feelings can make it hard to see solutions or believe that things can get better. If you feel overwhelmed by hopelessness or like you're stuck in a situation with no escape, it's important to reach out for help. These emotions can increase your risk for self-harm or suicide, so don't hesitate to seek urgent care if you're experiencing them. Sometimes, low mood can be accompanied by losing touch with reality. This might include seeing or hearing things that aren't there, hallucinations, believing things that aren't true, delusions, or feeling extremely confused. These symptoms can be frightening and signal a serious mental health crisis. If you or someone you know is experiencing these symptoms, it's important to seek urgent medical attention. Early intervention can help prevent further complications and ensure safety. A sudden and dramatic change in behavior can also be a sign that urgent care is needed. This might include acting recklessly, withdrawing completely from loved ones, or behaving in ways that are out of character. These changes can sometimes indicate a mental health crisis, especially if they happen quickly or are accompanied by other warning signs. If you notice these changes in yourself or someone else, don't wait to seek help. If your low mood is so severe that you can't take care of yourself, such as not eating, not sleeping, or neglecting personal hygiene, this is a sign that you need urgent help. When basic self-care becomes impossible, it can quickly lead to serious health problems. Don't hesitate to reach out to a healthcare professional or emergency services if you're unable to meet your basic needs due to your mood. Sometimes, a mental health crisis can also cause physical symptoms. These might include severe agitation, inability to sit still, rapid heartbeat, or even fainting. If you experience any of these physical symptoms along with low mood, it's important to seek urgent care. Physical symptoms can be a sign that your body is under extreme stress and needs immediate attention. Engaging in risky or dangerous behavior, such as reckless driving, substance abuse, or putting yourself in harm's way, can be a sign that your low mood has reached a crisis point. These actions can endanger your life and the lives of others. If you notice yourself or someone else acting in risky ways, it's time to seek urgent help. Mental health professionals can provide support and help you stay safe. Talking about death, dying, or expressing a desire to not be alive anymore is a serious warning sign. Even if these statements seem casual or offhand, they should always be taken seriously. If you or someone you know is talking about death or wishing they weren't alive, it's time to seek urgent care. These conversations can be a cry for help and should never be ignored. Another urgent sign is giving away prized possessions or making arrangements for your affairs. This behavior can indicate that someone is planning to end their life. If you notice this in yourself or someone else, it's important to act quickly and seek urgent help. Reaching out to a trusted person or professional can make a life-saving difference. Sometimes, a person who has been very distressed may suddenly seem calm or at peace. While this might seem like a good sign, it can actually be a warning that they have made a decision to end their life. If you or someone you know experiences a sudden sense of calm after a period of intense distress, it's important to seek urgent care immediately. Experiencing extreme anxiety or panic attacks along with low mood can be overwhelming and may signal a mental health crisis. Symptoms might include racing thoughts, shortness of breath, chest pain, or feeling like you're losing control. If these feelings are intense and don't go away, it's important to seek urgent help. Immediate support can help you manage these symptoms and keep you safe. Feeling emotionally numb or detached from reality can be another sign that your low mood is severe. You might feel disconnected from your surroundings, unable to experience emotions, or as if you're watching life from the outside. These feelings can be distressing and may indicate a mental health crisis. If you experience emotional numbness or detachment, don't hesitate to seek urgent care. Experiencing paranoia or extreme distrust of others can be a sign of a serious mental health issue. You might feel like people are out to get you or that you can't trust anyone. These feelings can be very isolating and may increase your risk of harm. If you notice these symptoms in yourself or someone else, it's important to seek urgent help. Using drugs or alcohol to cope with low mood can quickly become dangerous. Substance abuse can worsen mental health symptoms and increase the risk of self-harm or suicide. If you find yourself relying on substances to manage your mood, it's important to seek urgent care. Professional support can help you address both your mood and substance use safely. Sometimes, low mood can lead to aggressive or violent behavior toward yourself or others. This might include shouting, hitting, or destroying property. These actions can be dangerous and are a sign that urgent help is needed. If you or someone you know is acting aggressively or violently, contact emergency services or a mental health professional immediately. If your low mood is causing you to neglect important responsibilities, such as work, school, or caring for family, this can be a sign that you need urgent support. When you're unable to function in daily life, it's important to reach out for help. Early intervention can prevent things from getting worse and help you get back on track. Feeling completely overwhelmed by stress, to the point where you can't cope, is another sign that urgent care may be needed. Stress can build up and make it hard to manage even simple tasks. If you're feeling crushed by stress and unable to function, don't hesitate to seek help. Support is available and can make a big difference. Losing interest in all activities, even those you once loved, can be a sign of severe depression. If you find that nothing brings you joy or motivation, and this feeling is persistent, it's important to seek urgent help. This level of disinterest can signal a mental health crisis and should not be ignored. Withdrawing from friends, family, and social activities can be a warning sign that your low mood is becoming more serious. Isolation can worsen your symptoms and make it harder to recover. If you find yourself avoiding all contact with others, it's time to seek urgent support. Reaching out can help you reconnect and start to feel better. Sometimes, severe low mood can cause unexplained physical pain, such as headaches, stomach aches, or muscle aches. If these symptoms are intense and don't have a clear cause, they could be related to your mental health. Persistent physical pain, especially when combined with other warning signs, is a reason to seek urgent care. Severe sleep disturbances, such as not sleeping at all or sleeping excessively, can be a sign that your low mood is reaching a crisis point. Sleep is essential for mental health, and major changes in sleep patterns can quickly worsen your symptoms. If you're experiencing extreme sleep problems, it's important to seek urgent help. Experiencing rapid and extreme mood swings, especially if they include periods of agitation or euphoria, can be a sign of a serious mental health issue. These mood changes can make it hard to function and may increase your risk for self-harm. If you notice rapid mood swings, it's important to seek urgent care. Major changes in appetite, such as not eating at all or overeating, can be linked to severe low mood. These changes can affect your physical health and make it harder to recover. If you notice significant appetite changes, along with other warning signs, it's time to seek urgent help. Severe difficulty concentrating, making decisions, or remembering things can be a sign that your low mood is affecting your ability to function. If these problems are persistent and interfere with daily life, it's important to seek urgent support. Mental health professionals can help you manage these symptoms and improve your functioning. Persistent feelings of worthlessness or excessive guilt can be overwhelming and are often linked to severe depression. These feelings can make it hard to see your own value and may increase your risk for self-harm. If you're struggling with these emotions, it's important to seek urgent care. Frequent or uncontrollable crying, especially if it happens without a clear reason, can be a sign that your low mood is severe. If you find yourself crying all the time and unable to stop, it's important to seek urgent help. This symptom can be very distressing and may indicate a mental health crisis. Feeling constantly restless or agitated, unable to sit still or relax, can be a sign of a mental health crisis. These feelings can make it hard to function and may increase your risk for self-harm. If restlessness or agitation is severe and persistent, seek urgent care. A persistent feeling of emptiness, as if nothing matters or nothing can fill the void, can be a sign of severe depression. This feeling can be very distressing and may increase your risk for self-harm. If you're struggling with a sense of emptiness, it's important to seek urgent help. Feeling unloved or unwanted, even when others care about you, can be a sign that your low mood is severe. These feelings can be very isolating and may increase your risk for self-harm. If you're struggling with these emotions, don't hesitate to seek urgent support. Losing all hope for the future, feeling like things will never get better, is a serious warning sign. This sense of hopelessness can make it hard to see a way forward and may increase your risk for self-harm. If you're feeling hopeless, it's important to seek urgent care. Feeling like you're a burden to others, believing that people would be better off without you, is a common symptom of severe depression. These thoughts can be very dangerous and may increase your risk for self-harm or suicide. If you're struggling with these feelings, seek urgent help. Having unusual or bizarre thoughts, such as believing things that aren't true or feeling like you're being controlled, can be a sign of a serious mental health issue. These thoughts can be very distressing and may indicate a need for urgent care. If you notice these symptoms, don't wait to seek help. Hearing voices or sounds that others don't hear can be a sign of a serious mental health condition. This symptom, known as auditory hallucination, requires urgent medical attention. If you or someone you know is hearing voices, seek help immediately to ensure safety and proper care. Seeing things that aren't really there, or visual hallucinations, can be a sign of a mental health crisis. This symptom can be frightening and may indicate a need for urgent care. If you or someone you know is experiencing visual hallucinations, seek immediate help. Feeling extremely tired or having no energy, even after resting, can be a sign that your low mood is severe. This level of fatigue can make it hard to function and may increase your risk for self-harm. If you're experiencing extreme fatigue, seek urgent help. If you find yourself unable to communicate, speak, or express your needs, this can be a sign of a severe mental health crisis. Communication is essential for getting help, so if you're struggling to talk or reach out, it's important to seek urgent care. Support is available to help you through this difficult time. Feeling overwhelmed by guilt, especially if it's out of proportion to the situation, can be a sign of severe depression. These feelings can be very distressing and may increase your risk for self-harm. If you're struggling with overwhelming guilt, seek urgent help. If you stop caring about your own safety, such as not wearing a seatbelt, ignoring health advice, or putting yourself in risky situations, this can be a sign that your low mood is severe. These behaviors can be dangerous and require urgent attention. If you notice this in yourself or someone else, seek help immediately. If you experience any of the urgent symptoms we've discussed, don't wait to seek help. Contact emergency services, a crisis hotline, or go to the nearest emergency department. Your safety and well-being are the top priority. Remember, you're not alone, and there are people who care and want to help you through this difficult time. To sum up, low mood can become a serious issue when it's accompanied by urgent symptoms like thoughts of self-harm, suicidal plans, losing touch with reality, or severe changes in behavior. Recognizing these warning signs and seeking help right away can save lives. Remember, reaching out for support is a sign of strength, not weakness. Take care of your mental health and know that help is always available.